Welcome to Dr. Lottie Science with Soul. I'm Dr. Lottie and the host of this podcast. Today, I'm really excited to introduce Dr. Tania Dempsey. Dr. Tania Dempsey, MD, ABIHM, is a board certified in internal medicine and integrative and holistic medicine. She received her MD degree from the Johns Hopkins University School of Medicine and her BS degree from Cornell University. She completed her internal medicine residency at New York University Medical Center. In 2011, she founded her own integrative medicine practice, which has evolved into AIM Center for Personalized Medicine, a destination medical center in Purchase, New York, focusing on complex multisystem diseases. Dr. Dempsey is a leading expert in MCAS, Mast Cell Activation Syndrome, Dysautonomia, ME/CFS, Myalgic encephalo-myelitis, chronic fatigue syndrome, Tick-Borne Infections and Autoimmunity. She is an accomplished international speaker and writer and is well published in the medical literature on topics related to MCAS. She was involved in a research study in collaboration with the TILT, Toxicant Induced Loss of Tolerance team at University of Texas Health Science Center in San Antonio, which led to the publication, Mast Cell Activation May Explain Many Cases of Chemical Intolerance. Her most recent paper from January 2022 is titled Post-HPV-Vaccination Mast Cell Activation Syndrome, Possible Vaccine-Triggered Escalation of Undiagnosed Pre-Existing Mast Cell Disease. So welcome, Dr. Dempsey. It's such an honor to have you as a guest today.
Thank you. Thanks so much for having me.
So I am sure there are many listeners out there saying, what is MCAS, Mast Cell Activation Syndrome? So could you just briefly explain what that means? What kind of symptoms would people have if the listeners are thinking, oh, wow, maybe that's what I have? What are the different symptoms? How would it show up for them?
So would it be helpful maybe to even talk about what mast cells are? I think to understand this disorder better, we need to really understand like what the normal state in the body is. So mast cells are white blood cells. They're the type of white blood cells that actually are in our organs and tissues, and they are our first line of defense in recognition of the environment. So they help us, they protect us from our environment. If there is a infection, if there's a toxin, our mast cells, everybody has them, will react. And the way they react is, they have a lot of different ways they react, but one of the main ways is they sort of explode when they see something that's foreign that they're supposed to fight off. And they explode and they release what we call chemical mediators. These mediators are things like histamine is one, but there are really over 1,000 different chemicals or mediators that mast cells can make. And when they release these mediators, those mediators are supposed to help deal with that foreign body, environment, toxin, whatever. And unfortunately, in that attempt to protect us, those chemicals can actually then backfire in a way and then damage our own tissue. So histamine is very inflammatory. And so a release of histamine causes things to swell and causes other symptoms. So in protecting us, there may be some backfiring of the contents of what the mast cells are releasing. So that's like everybody. And I also mentioned that, people who, let's say, get exposed to the flu, COVID, these types of infections, they often have an acute exacerbation, acute reaction from their mast cells to help deal with it. They're also engaging other cells in the body to help fight off the infection. The mast cells are part of the immune system, so they're talking to other parts of the immune system. And then if you're normal and you don't have this disorder, MCAS, your mast cells reset and they wait for the next event. So what we're talking about with MCAS or mast cell activation syndrome is those people who have it have mast cells that are at baseline, we'll say they are dysfunctional. So they overreact, they may react inappropriately, they may react to an infection, but they never reset back to normal. So they may continue reacting and releasing these chemicals and causing inflammation. And so MCAS is a multi-system, because mast cells are in every system in the body. It's a multi-system inflammatory condition. And since it can affect every organ in the body and every tissue in the body, the symptoms are, very long list. But I can say that in general, MCAS usually presents in like three main themes. And I'll say allergic theme could be one. So some patients have allergic symptoms. They get hives, they get rashes, they get respiratory symptoms, asthmatic type symptoms. They go to the doctor, they get tested for allergies. Sometimes they find there is a true allergy, and sometimes there isn't an allergy, but the root may be that the mast cells. Now, mast cells are involved in allergy, that process anyway. They're the cell that releases the histamine that causes the congestion and the itchy eyes and things like that. So we know the mast cells are responsible for allergy, but most of these patients with MCAS, they don't have true allergy for the most part. They have an allergic-like reaction because they're releasing histamine. But the actual action is different. It's not an allergic trigger. It's a different type of trigger. Inflammation is definitely a theme that we see throughout. And then I'll use the term like abnormal growth and development or dystrophisms. So things like growths, cysts, lipomas, things that thyroid nodules, things that are growing in places that shouldn't, osteoporosis. So things that are not healing properly are also like in the theme of MCAS. But again, like going from head to toe, it affects the nervous system. So you can have headaches, migraines, cognitive issues. You can have, issues with eyes. You can have ringing in the ears. You can have various oral issues. It could be itching. It could be trouble swallowing. It could be ulcers in the mouth. Definitely we see thyroid dysfunction. We see spine, musculoskeletal issues. There can be misalignments of the various vertebrae. Connective tissue issues can be associated. Hypermobile Ehlers-Danlos syndrome may be associated. We know that there can be gynecologic associations, hormonal imbalances. We know that mast cells are involved in insulin resistance and prediabetes and diabetes, polycystic ovarian syndrome. So women who have abnormally high testosterone levels and insulin resistance, they may have acne, they may have abnormal hair growth, abnormal periods, PMS may be associated with that, endometriosis may be associated with that. And I can keep going and going, because unfortunately it really can, the symptomatology is really, long and very involved.
Yeah, so there can be many different types of symptoms. Correct. So for the listeners out there, when you've been to the doctor and they don't know what's wrong with you, then this could be something to look into. Would you say that EDS, hypermobility, and POTS and MCAS sort of go together, that triad?
Yeah, and I did mention dysautonomia as a symptom. It absolutely is. Yeah, the way many of us think about this is that the mast cells are in the nervous system. We know that there is a interplay, an interaction between mast cells and the neurons themselves, or in the brain, the microglia. There's communication, there's constant communication with mast cells and various things. So we know that for some people, dysautonomia is a neurologic condition associated with a neuropathy called small fiber neuropathy. And there's more and more research and at least a lot of anecdotal evidence too to support the fact that the mast cells are probably involved in that process of the neuropathy and then the dysautonomia. And the same can be said about connective tissue disorders. We know that there are many mast cells in the connective tissue. We know that if the mast cells are abnormal and they are reacting, aberrantly, then that can damage connective tissue and cause maybe increased, stretchiness, right, and hypermobility. Maybe it causes the opposite. I certainly have patients who are really stiff. They're like the opposite of hypermobile EDS, but they probably have a connective tissue disorder. So yes, we are starting to see this as associated. There's some genetic work that's being done at the NIH looking at the genetic connection. But I can say that mast cells are, because they're in all these different places, probably are the driver of those conditions, actually. Not so they go together as a triad, but the question is, what's really the root cause? And maybe there's something else even beneath the mast cells, driving the mast cells to drive that problem. But the mast cells are certainly involved in those processes.
Mm-hmm. And how would you go about testing for MCAS? If people are thinking, well, maybe I have that, what test would I do?
Yeah, and that's the challenge.
Right. I know.
That really is the challenge.
Mm-hmm.
So I think first, you want to see a practitioner who has some experience doing this. I think that if a practitioner has never heard of it, listen, they can certainly reach out to me, and I have a colleague here in the office, Dr. Lawrence Afrin, who's really also considered one of the world's experts in MCAS. We are always open. Our door is always open to talk to practitioners, to help guide them with their patients if necessary. But the reality is that you sort of the practitioner needs to know what to order and how to take this to the next level, because it is a little bit complex. But there are some very simple blood tests that can be done just as a screening tool. But I want to make a point that if they're negative, it doesn't mean that they don't have MCAS, because the problem is the mediators that mast cells make. There's like over 1,000 mediators. And so the way we diagnose mast cell activation syndrome is we look to see if we can detect those mediators. Because if we can detect the mediators, then it suggests that the mast cells have activated, have degranulated, have released their contents. So the testing we're doing is looking for these mediators. And there are several problems. We have 1,000 mediators, but we have maybe a handful, 2 handfuls of tests that actually can measure those mediators. So if you're one of those people who has a mediator that we can't measure, you might still have it, but we may not be able to prove it. That's a challenge. Some of these mediators are very thermolabile. They're heat sensitive, and so they dissipate very, very quickly. So if you collect it, we often do urine tests for some of this. And if the urine isn't kept cold, if the urine isn't kept in a certain way and delivered to the lab in a certain way, and the lab doesn't process it a certain way, you might not see it, and it might come back, looks like it's normal. So we often have to repeat testing. We often have to, especially if the clinical suspicion is high, we might not get the answer on the first go around. But generally the answer is it's blood and urine mainly. And sometimes there are biopsies that we can analyze for mast cells that can also help with the diagnosis.
So I would say it's really important to find a practitioner that is familiar with MCAS, because personally, in naturopathic medical school, we did not learn much about that. And it's not something that we have looked at. I think society sees as a common problem, but it's probably way more common than we think it is. So we didn't get barely any education on that. So it's really important to find somebody like Dr. Dempsey that can really help you along the way if you think you have MCAS. Now, you mentioned dysautonomia. So can you explain what dysautonomia is, just for people who are not familiar with that?
Sure. And you use the term POTS, or postural orthostatic tachycardia syndrome. That's one form of dysautonomia. But you have part of your nervous system is what's called the autonomic nervous system. And the autonomic nervous system is sort of the automatic nervous system, right? It's the part of the nervous system that you don't think about, that the function just keeps going on in the body. So the heart continues to beat. You don't tell the heart to beat. That's automatic. When you eat food, you don't tell your stomach, oh, you have to, contract and digest my food. It happens automatically. When you breathe, it happens automatically. So these are all parts of the autonomic nervous system, the nerves that dictate those actions. And dysautonomia is a dysfunction of that autonomic nervous system. So maybe the blood pressure, the heart rate, maybe the digestive process is impaired because of this issue at the level of the autonomic nervous system. It can be, I believe, very much that mast cells or mast cell dysfunction drives dysautonomia for a fair number of people. There may be an autoimmune component, and that autoimmune component may be associated with MCAS or may not be. And there may be actual neuropathic process damage to the nerves that lead down that path. And again, maybe mast cells are involved in that, maybe they're not. I try not to blame everything on mast cell dysfunction, but it's hard not to. But that's essentially what it is. And so patients will have symptoms like they may have very slow digestion, something called gastroparesis. They feel like the food sits in their stomach for a really long time. They're really uncomfortable. They may have issues further down, so their colon doesn't work properly, so they may be severely constipated. They may be people, they've tried everything and they still can't go to the bathroom normally. They may have POTS, or this postural orthostatic tachycardia syndrome, which essentially is a problem with regulating blood pressure and heart rate. And so a lot of these patients, when they change positions, they get up from lying down and they stand up to compensate for the sort of a decreased blood flow to the brain. They try to increase the heart rate. I mean, they don't think the body's doing it. Their heart starts to beat faster. And so they will often have a very high, a change in their heart rate from lying to standing. That's POTS. And there are various forms of POTS, but we don't necessarily have to go into it. But that's what it is. It's a dysfunction in the autonomic nervous system.
Mm-hmm. And the people who have MCAS, they typically can also have the POTS and the EDS, some form of EDS, even if it's hypermobility. How can the healing time also be affected? That these people just heal slower?
That's a great question, actually. And yeah, it does. So mast cells are involved in, I mentioned earlier, growth and development, and part of the growth is in healing. So after surgery, definitely I have patients who heal more slowly from any kind of wound. They might heal more slowly. Yeah, it's because their mast cells, if they have dysfunctional mast cells, they're not healing properly. If you have normal mast cells and you don't have MCAS, theoretically, your body should function and heal. So yes, that's a very good question. That is a big issue for a lot of my patients.
Mm-hmm. And what about I've heard about the low histamine diet, the diet for MCAS, so eating low histamine foods versus eating high histamine foods. What have you seen in that? Is that helping patients, or what's your take on that?
So I just wrote an article on this, actually, and I posted it on Facebook and my website if people want to read it more about it, because there are really pros and cons to this diet. And I'm of the mindset that there's no perfect diet for everyone, right? And that speaks to not just MCAS, but just in general, right? Everyone's genetics is different. Everyone's exposures are different. Everyone's likes are different. So the way I think about a low histamine diet is that it's going to help some people, which is great. And when it works, it's wonderful, but it may not help. And it might be that they need to combine it with other types of elimination diets. It might be that histamine is not their problem. Maybe there's some people who certainly are releasing a lot of histamine from their mast cells. There are people who have trouble breaking down histamine in their gut. They may not have enough of the enzyme that breaks down histamine called diamine oxidase. And so they wind up with too much histamine. And so, yes, if you lessen the amount of histamine that's going in through their gut, maybe it will help them. But maybe they have an issue not with histamine, but they have a different mediator that the mast cells are releasing, or they have, let's say, SIBO, or small intestinal bacterial overgrowth. And many of my patients have that. Well, for those patients, sometimes a FODMAP, low FODMAP diet will help them. Sometimes it won't, depends on the SIBO. But it's sort of like, again, I think it needs to be personalized. Every patient needs to be personalized. There's no perfect thing for everyone. I think the low histamine diet is a tool for some people, and really trying to figure out who the right person is. A lot of people who are listening, they may be thinking, oh, maybe I should try it. There's not a lot of downside, generally speaking. It's better to be, if it's done under the care of a healthcare practitioner. But for some people, it makes things worse, because maybe the foods that are low in histamine are the foods that irritate their gut for other reasons. And so again, I think it needs to be individualized.
Yeah, I couldn't agree more. There's never a diet that works for everyone. It has to be individualized to that person, because everybody has different food allergies, and you got to take all these different things into account. So when you're looking at the mast cell activation syndrome, what have you seen? It's after this COVID, after the pandemic, there's many people that were completely healthy before they had COVID. They might be in their 30s. And now all of a sudden they had COVID and they can barely get out of bed.
Right.
Do you think that there is some connection to like activating that mast cell in these people that had an underlying problem from the beginning, but now they had COVID, or they got the vaccination, or they got some other vaccination, and something comes along and triggers that? Have you seen anything like that?
Yeah, that's the premise that I sort of go by, when I treat patients who have post-COVID, post-vaccine, post something like that. Yeah, I believe, just based on my knowledge of the mast cell and based on the understanding that mast cells react to infection, what I suspect, and actually some of this is rooted in that article that I published on post-HPV vaccine. And I know it sounds like, well, what does that have to do with COVID? But our premise was that the people who wound up with reactions to the vaccine might have had pre-existing MCAS that the vaccine then brought out. And so that's the premise that I go under for post-COVID and post-COVID vaccine. That I believe, because the patients that we're seeing, and I definitely need to publish on this, often they were healthy, but with a proper history, which I'm really, really, very anal about, in terms of like going from pregnancy of their mother, the health of their mother when she got pregnant, if they know that information, all the way to that COVID diagnosis. Very often there is a flavor of mast cell activation syndrome that's very subtle, but they were very healthy. And so their mast cells might have activated at periods, and then they leveled off. And so they generally felt well. They could be athletes. They could be, very, very high functioning people. COVID, because of the way this virus works in the body, I mean, certainly any virus is going to activate mast cells, but for some people, maybe it's remnants of the proteins of the virus that are left in the body. Maybe it's that the mast cells were not normal before COVID. Whatever it is, it really triggers the mast cells to go into this state of continued activation. And so for many of my patients who are sick after COVID, I'm using a mast cell targeted treatment protocol. And for many, that is helping. There may be other pieces to this, right? I'm not one to believe that there's just one answer. There may be other reasons and other things that patients need to be treated with. But in my patients who I've been treating for MCAS and who get COVID, their risk of having a long COVID is very reduced, because I'm already treating their mast cells, which I think is interesting. So most of my patients have done very well if they've had COVID because we've been so aggressive about making sure their immune system is as good as it can be. Of course, it's not perfect, but so yes, so the answer is that I think that we need more research. I think we need to start thinking about how the mast cells are involved in this process, and hopefully that will improve, so many people, lives who are so sick.
Mm-hmm. Absolutely. It's like whatever was there before is going to get triggered and things come to the surface.
That's
Now,
what
I know you also work with Lyme disease.
Yes.
So how would you say Lyme disease interacts with mast cell activation syndrome?
Yeah.
Because there are two things that often get missed, I find are often missed by regular healthcare. People are not tested for Lyme. They're not being looked at as an MCAS patient.
Correct. And, I would say really I'm an expert in vector-borne infections, even beyond just Lyme, things that, Bartonella, Babesia, there's a lot. I mean, I can name many, many different infections that can be transmitted by insects of various kinds. And I think that it is really at epidemic proportions as far as I'm concerned, because look how many insects we have in our environment. Look how many people get bitten by insects every day. How can it be that, that it's not affecting people on some level? And so because mast cells are our first line of defense against infection, they absolutely are going to be involved and get activated. The challenge with some of these infections is that they have, once they've sort of invaded the body, sometimes a person with a normal immune system will see that infection, will mount an attack, and will take care of it. And maybe that person will have gotten antibiotics if they knew they had a tick bite, or some kind of herbal protocol, and maybe that will help. But for a lot of people, these infections get into the body, and then they go into sort of a camouflage mode where the immune system cannot recognize them. So the mast cells may be activated. They're fighting something. They don't even know what they're fighting. It's almost like a, it's a dysfunctional system, right? So they don't even know what they're doing. They're just, exploding, reacting, causing more inflammation, sending signals to the rest of the immune system. But the infection itself may be hiding in the cells, maybe wreaking havoc, causing damage. And I think that's the problem. So by the time a lot of these patients come to me, they have had, unfortunately, have had chronic infections, which, a lot of the conventional medical world doesn't believe, but it's hard to not believe now that we're starting to have more research coming out of great institutions like Johns Hopkins, who's looking at persister infections like Lyme and Bartonella. And these patients have had chronic infection, chronic mast cell activation syndrome secondary to the infection. And at some point, it's sort of, what do you go after first? Do you go after the mast cell? Do you go after the infection? But sometimes you have to do all the above.
And what are the types of symptoms that people would get from Lyme disease? Now, I know you could have neurological symptoms. You could have, feels like you're walking on glass. And there's so many symptoms that I think people are not aware of. People just think, oh, I didn't have a rash, so I don't have Lyme disease. Right. What kind of symptoms do you see people coming with for Lyme?
So if we're going to talk just about Lyme disease, which is the disease caused by the bacteria Borrelia burgdorferi, there's a set of symptoms, but it can be varied. And there's some people who don't meet the, they don't have the symptoms on the list, but they still might have Lyme. But Lyme can invade the nervous system, so it certainly can cause things like autonomic dysfunction, especially if it's ramping up the mast cells. It can cause headaches and migraines. Chronic migraines we see very often, but those can also be caused just from the mast cells. So what you start to see is that, and I've presented on this, the list of symptoms from Lyme can match the list of symptoms from mast cell disease. And again, is it the mast cell disease that's being kicked up by the infection, and that's the manifestation that you're seeing? Hard to know, but Lyme disease can present as joint issues, joint pain. I've seen joint swelling, Fatigue certainly is a problem, and I'm sure I'm missing out. There are lots of them. The one, infection that let's say two infections that I really think are worth mentioning, because I think that they're probably even more common than Lyme disease, but more underdiagnosed, is Bartonella and Babesia. So if we start with Bartonella, I hope you don't mind me. I have
No,
to.
absolutely. I was going to go there. So just
Okay, good, because
yes.
I'm really, it drives me crazy because I know that there's so many people out there suffering with this, and there's just not enough attention given to it. And I think about, in medical school, I learned about a condition called cat scratch fever. It was Bartonella Hensley, and you got bitten by a cat, and you got this cat scratch fever. You took a week of antibiotics, and it went away. That's what we were taught. This is not a big deal, However, right, what I know now is that yes, the cats are transmitting it. Fleas are transmitting it probably on the cats. Fleas are carrying it. It's much more than just a bite and a week of antibiotics. It can be a very persistent infection and chronic infection. There are multiple strains of this Bartonella. It can be transmitted by almost every insect. So it is a vector-borne infection that can come from, again, cats. Dogs can carry it. All mammals can carry it. So any kind of contact with animals can transmit it. The fleas that live on those animals, flea bites, lice, spiders, biting flies, I'm sure sand flies. And so, again, if you think about the number of people who have had contact with animals, who have been bitten by any of those insects, and maybe mosquitoes as well, there are some publications out of Europe showing that mosquitoes are carrying Bartonella as well. How many people have been bitten by a mosquito? And so again, if there's a dysfunctional immune system, maybe patients are getting Bartonella, it's becoming chronic. And the symptoms that we see with Bartonella, again, you don't need to have all of these symptoms, but neuropsychiatric symptoms are very, very common and can be very severe. There are reports and the literature about schizophrenia being caused potentially by Bartonella, and OCD, and autism, and a variety of other neuropsychiatric issues. Again, Bartonella is likely the driver, and I would argue also that the mast cells play a role there. The other thing I see with Bartonella is feet pain, pain in general. The amount of pain compared to what is found on the body is disproportionate. Leg pain, muscle pains, sometimes joint pain, memory loss. I have patients who present with dementia. They might have Lyme too. Sure, that can cause some of these issues, but I think Bartonella by far does it more. So those are the common things. I absolutely see Bartonella also affecting the metabolic processes and the endocrine system. I've seen type 1 diabetes present after Bartonella infection. I've seen type 2 diabetes present after chronic Bartonella infection. Weight gain, obesity can be a problem. Often the type of weight gain is disproportionate to what they're eating and their lifestyle. So I think this is important because so many patients present with issues with their blood sugar, issues with they can't lose weight. And I think that's something that should be on the differential is Bartonella, or maybe one of these other vector-borne infections. Babesia is worth talking about as well. It is a parasitic infection. It can be transmitted by ticks. It can be transmitted by mosquitoes. There may be other vectors that can transmit it as well. It is found all over the world. So is Bartonella, by the way. So where we think about, I think it's important to note that, when we see maps, like the CDC has a map of the Lyme endemic regions of the world, there are definitely gaps. There are definitely areas where you might not see Lyme. And we can argue that maybe there is really Lyme there. There are other strains that they're not measuring and they're not looking at. I would definitely argue that. But when you look at the map of Bartonella and you look at the map of Babesia, it is covering everything. It's in sub-Saharan Africa. It's everywhere where you think you wouldn't necessarily see ticks, okay? Because it's being transmitted in these other ways. Babesia is similar to malaria. in terms of its genetics. And so it can act similarly, but also in different ways, and it can become chronic. It often causes people to have heat intolerance, sweats, night sweats, day sweats. Often, if this is happening in a perimenopausal or menopausal woman, it's very confusing. All the doctors want to blame it on the hormones. And many of these patients, they've already been treated with hormones and now they're having these symptoms. So that's something to think about. They often have tachycardia, dysautonomia, weight gain also can be associated. And so, and again, all those symptoms also can be associated with mast cell activation syndrome.
Yes,
so
very confusing for the patients.
very confusing, and for the doctors and practitioners who are seeing that.
Yeah, it's hard to distinguish between all of them. Would you say that iLads is a good resource for people to go learn more about Lyme and its co-infections?
Oh, absolutely. I'm a member of iLads. I did some work. I was on the faculty this year for their annual conference. I taught on actually Bartonella. They have a great training course every year that they do. They have other types of trainings that goes on. They have a lot, that goes on throughout the year, and they have a webinar series they're starting soon. I'm actually going to be speaking at their webinar in December. And I think they're trying to get the information out there. And so there are a lot of resources for patients, but also for practitioners, because that's really, I think it's the patients who are driving the practitioners to start learning about this. I hope that that's going to be what happens. When physicians see patients who are sick, you hope that they will go out and start to learn and join iLads and see if they can expand their knowledge base.
Yeah. And you were mentioning that this is found all over the world. So, a lot of people think that, tick bites is something you get if you live in New York or on Long Island, right? And it's an East Coast disease, but in fact, it's found in all states in the United States.
It is.
Yeah.
And again, I mentioned Lyme disease as Borrelia burgdorferi, but there are other Lyme disease related infections. There are these Borrelia species, and they're found in other parts. So we may have Borrelia burgdorferi here on the East Coast, Connecticut, New York, down the Eastern Seaboard pretty much, but you start to go out west, and there are different species. Borrelia mayoni is in the Midwest. Then there are Borrelia afzelii and guarini. They're in Europe. So, and they're causing a Lyme-like syndrome. For all intents and purposes, it looks like Lyme disease. It is Lyme disease, really. And so, right, recognition of that is important. But yeah, unfortunately, the medical world is just not ready to embrace that.
So all these different species of Lyme, different kinds of Borrelia, when you go to the doctor and they say, okay, well, let's test you for Lyme, do they test for all of those different species across the United States, or do they only test for a few of them?
Right, just a few, and it depends on the lab. There are labs now that are I think, pushing the envelope in terms of the advancements, that they're trying to test more, they're trying to provide better service for patients and practitioners. But so we have a few labs that might measure or look at antibodies to all these different species. But even some of the really great labs out there, they're mostly looking at Lyme. Tick-borne relapsing fever is another common infection. It is a Borrelia species also, but it's like a cousin to the other Borrelias. And that can cause this sort of relapsing fever syndrome that can look very much like Lyme. And so some of the labs are starting to test that, but the practitioners need to, the clinicians need to know what to test, what lab to use, how to get this information. So Bartonella, for instance, there are, I think the last count was something like 40 species of Bartonella. There's no lab that's testing all 40 species. We think that humans are probably infected by maybe 12 or 13 of those. There still isn't any lab that's testing every single species of those. There are more and more labs that are now testing the more common species of Bartonella that we might see in humans. But I think it's getting better. The testing is getting better, but we're not there yet. And again, it does rely on the clinician to really know what to look for.
So how do the listeners, if they think, that's it, I probably have Lyme disease, how do they go about figuring out what lab to use or how to find a physician that uses the correct labs versus the more traditional labs?
Yeah, it's a good question. You know, you call, you talk to the front desk and the office, and you try to get some information. iLads is a great resource. There are other organizations, Lyme organizations, that are trying to get, you know, the word out. Some of them have resources, Project Lyme, LymeDisease.org, I think, is another one. So there are a number of these places where they sometimes have lists of practitioners who are knowledgeable. And again, there's definitely wide variety and different practices amongst them. That's no guarantee, but at least you're getting closer, right? These people are at least interested in this group of diseases.
Mm-hmm. How did you become interested in tick-borne infections and mast cell activation syndrome?
It's an interesting story. So as far as Lyme and vector-borne infections, you know, I'm living and I'm practicing in an endemic area of the country. And, you know, before I started my own practice, I was an internist, a general internist, and I was, you know, seeing a lot of patients, you know, very, very often because that was the model. And then I went on my own, and I was practicing in a town called Armonk, New York, which is really kind of upper Westchester County in New York. And again, endemic region with a lot of Lyme disease. And I was speaking at a conference. I had started speaking about some of my things that I had started to understand. And it wasn't mast cell then. It was really things like methylation disorders and histamine, which I didn't understand as part of the mast cell thing yet. But I was starting to sort of put these pictures together. I was starting to understand the types of patients I was seeing and starting to put the pieces together on the puzzle. I was speaking at this conference, and Dr. Richard Horowitz spoke at that conference. He was one of the speakers. And I remember talking to him. He spoke and I spoke, and then I said, "Oh, I loved your talk." And, you know, really kind of got, you know, the wheels turning. And he said, "Oh, where you're practicing, you must be seeing tons of Lyme disease." And I was like, and I just remember him saying that. And I remember standing there going, "Oh no, oh no, oh my gosh, how many patients am I missing?"
Mm-hmm.
You know, and I said to him, "No, I have like maybe, you know, a handful of Lyme cases." And he said, "No, you don't." And I just remember I went back on Monday and I said, "Oh my gosh, oh my God, what am I missing here?" And then it just started. As soon as I saw it and it made sense, then it was like no turning back. Then I couldn't learn enough. I couldn't understand enough, like, to help patients, because I saw these patients who, you know, you would do things, you help their gut, you clean up their diet, you help their lifestyle, you help their hormones. Yeah, and they get to a point, you know, maybe they get better, but there were these patients that just weren't getting better the way I would want them to, right? So that was the Lyme piece. And then once you start dealing with that, you know, what I started seeing were patients who are reacting to the medications, to the herbs, to the supplements. I started noticing, you know, my really sensitive patients, and I was having more and more very sensitive patients. And I remember I had one patient who was relatively healthy, doing well, and then all of a sudden got some kind of viral infection, and then went, you know, off a cliff. She really spiraled down. She started reacting to everything. We couldn't figure out what was going on, why she wasn't responding to the various things we were trying. And I remember I just was scouring the internet, the literature. One night I just came across mast cells and mast cell activation. And I remember I saw her in the office a few days later, and I said, "There's this condition. I think you have it." And this was in 2015, maybe 14. And so, you know, mast cell disease was really only just starting to be recognized. And so I was like, "I think you have this." And actually, fortuitously, it just sort of worked out. She had a family member who knew Dr. Lawrence Afrin, who was at that time really one of the leaders in mast cell diseases. And she said, "You know, I think you two should talk." And I said, "That would be great. I would love to talk to him." And we talked, we had a great conversation. I learned so much from him. And then that was it. now I couldn't unsee all the things that I was seeing with mast cell disease. And then of course, in 2017, Dr. Afrin came and joined my practice because we had really connected, and he saw the types of patients I was seeing and my interest, and I wanted to do more research, and so I brought him over, and that's the beginning of, you know, this whole journey of MCAS and Lyme.
Wow, that's a great story. But isn't that the truth, though? That's how we get roped into dealing with different kinds of specialties. It's always a personal story behind everything.
Oh, absolutely.
So do you think there's been an increase in the number of patients with MCAS over time?
Yeah, I do think so. Right now, the estimate in the literature is about 17% of the population. And I think it's important to note that, you know, there's a spectrum of MCAS disease manifestations, right? There are people out there who have very mild symptoms. They may not even know they have it. And then the other end of the spectrum where they have very severe disease. So if the literature says 17%, that may be an underestimate. And I would say that we're probably closer to 20%, which is 1 in 5 people. Now, the question is, was that the number? Did we have that number back 20 years ago, 50 years ago, et cetera? And hard to know. I'm not old enough to know if we had that. And maybe we've just become better at diagnosing it or recognizing it. But I think it's clear to me that my practice has definitely shifted in the sense, yes, because I'm a specialist, of course I'm gonna draw in patients like that, but it just seems like the toxicity of the world. Now I'm gonna be really negative, unfortunately.
That's okay.
There's so much toxicity in this world, both emotionally and environmentally, pesticides and plastics, and you know, the list goes on. Then, so I think that's impairing our immune system.
Mhm.
Then I think that's making people more susceptible to these various infections. I think there are lots of people who have had Lyme and Bartonella and other things over the course of our lifetimes or longer, but maybe they didn't get as sick. Maybe it's because our immune systems are impaired. You know, the mold in the environment, the types of building materials we use now versus what we used to use. So I think that in general, our mast cells. I shouldn't forget EMFs, right? And all the screens and everything. So we have all these triggers for mast cells more than ever. And so it just seems like that's just going to set us up for worsening, you know, or an increasing number or prevalence of mast cell activation syndrome.
Mm-hmm. What words of wisdom would you give to patients who are suffering with the chronic illnesses?
I think most importantly, I say this a lot, they have to listen to themselves. Because unfortunately, the medical community sometimes doesn't validate them, you know, blames it on psychiatric issues, or it's in their head. And I think just to continue to believe that you know your body better than anybody else. And if there is something that you believe that is not right, keep searching. I know it's hard. I know many of these patients have seen lots of practitioners and have not really found the answers, but I just, you know, keep listening to your heart and listening to yourself, because ultimately that's eventually will get you to where you need. There will be somebody like me who's going to listen, who's going to take every word that you say, you know, with meaning, and put it together in the puzzle, put the puzzle pieces together, I should say. But yeah, unfortunately, you know, our profession hasn't done a great job at validating patients who have these types of symptoms that don't make sense to them, but make a lot of sense to me and to you, right?
Right, absolutely. That's good advice. Always listen to your own body. So how can people learn more about you? What's your website?
So Dr. Tania Dempsey, it's Tania, Dempsey.com is my website. I have a Facebook page, Dr. Tania Dempsey, and Instagram, Dr. Tania Dempsey, MD. My practice is AIM Center for Personalized Medicine. I do have a website for that too. Yeah, I think that's the best ways for, I have a lot of podcasts that I do and interviews, and I've put online some of my talks that I've given at various conferences, and I'm just trying to put the word out, and educate as many people as possible, because again, I think not everyone can see me, but if I can give this information out, so that I can validate the patients who are suffering, and also help other practitioners understand that they need to take this on and start to help patients too. So I love all that stuff. I have a lot of stuff out there if people want to read and listen and whatever.
So I'll put your link in the podcast notes as well. So it's
Great.
drtaniadempsey.com. And we'll try and get the Facebook link and the Instagram link into the podcast notes as well. So just go click on that. And she has a wealth of information on her website, lots of different interviews. So you can learn even more about what it is that you're trying to heal by going to her website. So I want to thank you so much, Dr. Dempsey, for taking the time and being a guest on the podcast today.
Thank you for having me. Appreciate it.